So today I want to talk about a topic that I feel like gets brought up by every nursing student ever, and that is, why is nursing school so hard? I think that people in nursing school, before going in, I think that we don't realize how hard it's going to be. I mean, everybody knows that medical school is really hard and law school is really hard, but nursing school really doesn't have a reputation of being super hard because I think that people don't really talk about it often. But I am here to talk about how nursing school is extremely, extremely difficult and why that is. So, the number one reason that nursing school is difficult is because at the end of all of it, we are taking a state exam, and our schools are judged off of how we score on that state exam. Our schools will actually not get accreditation if they consistently score low. And when I say low, it means that schools go on warnings when their pass rate is in the 70s. So, that's really not terrible. I mean, it's not like you have to be scoring minimal to have your school not be accredited anymore or be put on a warning. So that's the first thing, is that these schools do need to weed out the people who are not going to pass this exam so that they have a high pass rate. The other reason nursing school is so difficult is because there's only so many clinical placements and so many nursing professors, meaning that there's only so many programs that have nursing students, which then means that these programs are super competitive. For example, my school had 800 applicants for 50 spots. I mean, that's crazy. That's less than 1%. So not only are you talking students that are high achievers, you're then talking about that they need to weed out the weak high achievers. So that makes it already really difficult, because you're going against people that are super intelligent and they're trying to weed out the bottom percentage of people. So on top of that, I mean, if you think about it, nurses are the front line of defense in patient care. We're the ones working directly with the patients 8 hours a day in the acute hospital setting, or 12 hours a day. We are the ones that are going to see the deterioration signs and be able to intervene and save people's lives. I was actually reading in my nursing textbook the other day, and it was talking about how back in, the 1950s and 1800s, nurses were often acted sort of like the CNAs act now. They pretty much just did whatever the doctor said. And nowadays, nurses actually have some autonomy. They can choose if they want to act out what the doctor is saying, or, advocate for their patient for maybe something else. Needs to be able to know the pathophysiology of disease, be able to understand the signs and symptoms of deterioration. So back in the day, right, if a doctor prescribed a med and the nurse gave it, the nurse could use the excuse, the doctor told me to, and they wouldn't be liable. However, that has now changed. If the nurse gives a med that should not be given to this patient, even if the doctor prescribes it and it's like it causes an adverse effect, and the nurse can be held liable. The nurse is the last line of defense against a med error. So now nurses need to be knowledgeable of all the medications, the adverse effects, what they should and shouldn't be given with, what diseases, the meds are used for, and what they shouldn't be used for, and things like that. So really the scope of nursing has expanded so much. On top of that, nursing school is not known to be super difficult, and I think that comes from nursing curriculum being a semi-new thing. Law school and medical school have been very challenging for a very long time, but the career of nursing, the curriculum, is a semi-new thing. It's always changing, and it's getting more and more difficult because nurses are on the front line, and nurses are liable for knowing what patients should and shouldn't be taking, and knowing their disease processes, and knowing the way that they present, and when problems present, what those are. And let's be honest, if God forbid something ever happened to us or one of our loved ones, we want to know that the nurse caring for them knows her stuff, takes good care of them, and can identify if a problem is happening. So that is why nursing school is so difficult. So if you liked this video, please subscribe below and give it a thumbs up. Make sure to comment. I like to hear everything you guys say. And I will see you soon. We have new video content every Wednesday and a new vlog every Friday. Thanks. Bye.